In today's video, I will discuss about the AI in clinical setting. First, I will discuss the pattern recognition part. In this, first let me discuss the AI in ECG interpretation. So the Mayo Clinic has developed the AI tool which can detect the heart failure from the standard 12-lead ECG. What they are claiming is that they can detect the ejection fraction less than 40%. So the impact here is that it can diagnose the silent heart failure years before the symptoms can appear. So current status is that this device is or this tool is FDA cleared. If I want to discuss the Indian version of it, then Narayana Health Hospital and the Medha AI come together to develop India's first indigenous AI model that can also diagnose the heart failure from the simple ECG in 10 seconds. The highlight of this tool is that it is the train on the more than 1 lakh Indian patient record, and these records are the raw photos on these records are the raw photos and PDF of the ECG strip. Unlike the Western country where they have the where they have the electronic medical record. So clinically, statistics said that it can detect the heart failure 58 days earlier, even before the echo can pick up these changes. Next is AI in digital stethoscope, or we can say digital stethoscope, which is powered by the AI, which is the AI phonocardiography. So the company Ayushink provide the AI-powered digital stethoscope, which can amplify the sound 60 times and do the AI-based noise cancellation. What I mean by AI-based noise cancellation is that it can remove the common Indian noise, which are the noise of the fan, the traffic, the ongoing train, the chaos of the common Indian word. Next is the AI in EEG interpretation. So we have this AI tool which by the name of the U-Sleep, which can analyze your entire EEG. But I want to discuss the few things about this, that it can be helpful in epilepsy detection or the seizure detection. So what it can do is it can do the 24-hour seizure detection. So there are a chance that patient might have some abnormal discharge in the brain, but it cannot result the abnormal bodily activity. So this AI can tell the doctor that at this particular point of time patient had this type of discharge. Similarly, it can do the artifact removal. It is helpful especially in polysomnography. So in polysomnography, if let's say if patient blinks or moves the hand, we can get the artifact in EOG and EMG graph. So this artifact removal can be done by this U-Sleep AI. And last but not least is that it can detect the slip spindle density. What I mean by the slip spindle density, it can give you the number of slip spindle per unit of time. And studies have shown that diseases like the schizophrenia have the reduced slip spindle density. So counting the slip spindle density manually is the very time consuming process. The next is AI application in imaging and the diagnostic, in which I want to first discuss this chest X-ray and CT head. So chest X-ray and CT head analysis is currently being done by the Cure AI, which is the global Indian giant company. So if I want to discuss the chest X-ray reading by the Cure AI, I want to highlight this study by the Singhs and other in 2018. The result shows that this AI can not only common lung pathologies like the lung abscess and lung nodule, but it can detect the cardiomegaly from the cardiothoracic diameter, and it can detect the pleural with the area under curve of 0.93. So statistically, the curve 0.9 is considered very significant. So here we have the curve of 0.93. The only drawback is that currently this AI tool is struggling with the detection of the implanted device and the follow-up changes, which normally requires the human contextual understanding. Next is we have the CT head analysis by the Cure. So this study in 2018. In this study, they have analyzed more than 3 lakh Indian CT head, and the AI's performance is that it can detect the bleed, fractures, midline shift, mass effect with the area under curve of more than 0.9, which simply means that we can use this particular tool as a triage tool in our trauma and emergency ward as a screening method. We all have read this news that AI is being used by the AIMS New Delhi. So we have this X-ray report that suggests it is generated by the AI. And this is the clarification that is given by the AIMS. So what they are saying is that they are having the high patient load, and the AI that they are using is having the high negative predictive value. So what they are doing is that if the AI report any X-ray as a normal, so they can give it to the patient, so the patient do not have to wait for long hours. And if the AI mark any particular X-ray as abnormal, then this will be confirmed by the radiologist. Our government also uses the AI-based chest X-ray screening for the TB Mukt Bharat Abhiyan. And here the government clearly mentioned that it is using the Deep CXR tool as a screening AI tool for the chest X-ray. Next is in the imaging, we have the oculomics. So the Google has developed the AI that can predict some interesting fact just by seeing your retinal scan image. So the idea here is that only site in the human body where we can see our central nervous system. So if you upload your retinal scan image to this particular AI, what it will do is it will generate these heat maps to analyze your retinal blood vessels, and by the analysis of your retinal blood vessel, it can predict your age, your gender, your smoking status, your blood pressure, your BMI, your HE, and above all the information, it can give you the risk of major adverse cardiac event within the 5 year with the 70% accuracy. The Indian version of this particular thing is the automated retinal disease assessment tool, which is developed by the Google and the Arvind Eye Hospital of the India, which is especially for the detection of the diabetic retinopathy, which is trained on more than 6 lakh Indian patients, the rural Indian patients, having the sensitivity of 97% for the detection of moderate to severe diabetic retinopathy and specificity of 96.4%. How this tool will be useful is that similarly as this tool is also having the higher negative predictive value, we can use this in our rural where we can filter out the normal patients. So the ophthalmologist or doctor will see those patients who actually needs the treatment. Next is AI application molecular physiology. So in 2024, the Demis Hassabis and John Jumper won the Nobel Prize for developing the AlphaFold 2 along with the Google. So what this AlphaFold 2 is doing is that when you when you give the amino acid sequence of any protein, it can generate you the virtual 3D structure of the protein. So which means that we can bypass the long and time consuming process of X-ray crystallography for predicting the protein structure. But our today's highlight is not the AlphaFold 2. It is its next version, which is the AlphaFold 3. So this AlphaFold 3 not only predict the protein structure, but it can also predict that how the two protein will interact with each other. So this is the interface of AlphaFold 3, where you just have to upload the amino acid sequence of any protein. And when you click on the continue, after some minute, you will get the 3D structure of any protein. Not only that, Fold 3 can also predict the protein interaction. So this will be useful in virtual drug discovery. So let's say I am having this insulin receptor. So when I upload this insulin receptor structure of this insulin receptor into the AlphaFold 3 and ask that prepare me or find me a drug or ligand that can block the insulin receptor. So this AlphaFold 3 will give me the virtual structure of ligand or the protein that can block this insulin receptor. Not only that it will give me the structure, but it can also give me the amino acid sequence that I need for building this receptor. So which means that we can bypass the long process of trial and error of drug discovery. Similarly, this model can also predict the interaction between the protein and the DNA. And lastly, it can also be useful in antibody engineering or antibody making, where if we know the structure of the antigen, we can ask this model to develop the complementary antibody protein. Next is application in homeostasis and prediction. In the first, we will discuss the metabolic physiology. So in the metabolic physiology, I will discuss about the insulin delivery system. So right now, what you are seeing on screen is the two traditional method of insulin delivery. In first image, the patient have to manually check the blood sugar and deliver the insulin manually. And second image, the continuous glucose monitoring is being done, and patient manually have to enter the amount of insulin in the insulin pump, which will deliver the insulin, which means the patient have to do all the works. Now comes the hybrid closed loop, which is the AI powered device, anti-slim. What this hybrid closed loop is doing that it continuously monitor your blood sugar, and according to your blood sugar it will release the insulin automatically. So it is partially mimicking the our beta cell of the pancreas. But the only drawback is that while having a meal, patient have to do the carb counting. So patient will have to tell this particular device that I am having this much amount of glucose. So patient have to do the carbs counting. Our next device, which is the bionic pancreas, which is the islet device, which is the AI powered device which will completely mimic your beta cell, which not only continuously monitor your blood sugar and releases the insulin, but while having the meal patient do not have to do the carb counting. So instead of it, patient only have to say that I am having my regular or small or large size meal. So based on the previous eating history, this AI tool will know that what is the regular for you, and it will releases the insulin accordingly. So currently this device is FDA clears. So this is just a representational image that in first photo patient is having the manual insulin delivery system where patient have to do the all works. In hybrid closed loop, patient have to do the carb counting. And in the bionic pancreas, patient do not have to worry at all. He or she can eat anything. The next is the virtual hemodynamics. So this is having, so this photo is the CT, this photo is the CT coronary angiography. So let's say in the CT coronary angiography, if I get the blockage of less than 40%, then I will put the patient on the medicines. If I get the blockage more than 90%, then I will go for the stenting for that particular patient. But if I get the blockage between 50 to 90%, in this stage I will have to go for the FFR, which is the fractional flow reserve. So by doing the FFR, I will get to know about the collateral. In some patient there might be enough collateral developed. So this particular type of patient will not get any benefit from the stenting. And in some patient there are no enough collateral developed. So this type of patient can be benefited from the stenting. So for doing this FFR, I will need to do the invasive coronary angiography. I will take the arterial access and pass the catheter into the coronary artery. So here I am passing my catheter into the coronary artery. This is the site where the blockage is there. So this catheter is also having the pressure sensing tip, which I will pass distally to the blockage. The idea here is that whenever I do the pressure changes proximally, if there are enough collateral, then this pressure should reflect distally to the blockage. And if there are no enough collateral, then this pressure changes will not be reflected here. So the FFR, the formula of the FFR is the pressure distally upon the pressure proximally. In normal person, it is the 1. In case of blockage, if I get the FFR of more than 0.8, which means there are enough collateral that are transmitting the pressure. So this type of patient will not get any benefit from the stenting, and I will put this patient on the drug treatment. I will put this patient on the drugs. If I get the FFR less than 0.8, which means that this type of patient is not having enough collateral to transmit the pressure, which means I have to do the stenting in this patients. So now the AI will enter into the chat. We have this tool that is the name of having name of the heart flow. Now this heart flow, we just have to put the CT angiography report into the heart flow. Now from the CT angiography, this heart flow device will actually calculate the FFR based on the CT scan. So we can call this FFR as a FFR CT. So we just bypass the painful step of invasive coronary angiography. So let's say if this patient was having the 70% blockage, and if I uploaded this into the heart flow and I'm getting the FFR CT as the 0.98, which means this patient is having enough collaterals. So I will just put this patient on the medication. And if I get the FFR CT less than 0.8, I will confirm this with the traditional FFR measuring method, that is the invasive coronary angiography, and then I will decide my treatment. So the FFR CT measurement by the heart flow is having the sensitivity of the 86%, specificity of the 79%, and area under curve of 0.9. The other thing that other than the FFRCT, HeartFlow can offer is that it offers the virtual stenting, which means that before the surgery, surgeon can plan or surgeon can decide the uh, length and the width of the stent before the surgery. Other than that, it can generate the color coded coronary arterial map. Also, it will give the vessel specific FFR. Currently, according to the NICE guideline of the UK, they recommend the FFR CT by the heart flow for the analysis of the analysis for patient with the stable chest pain. Lastly, we have the AI application in the robotic surgery. So in Da Vinci 11, we have the robotics arm that closely mimics the surgeon hand's movement, but it lacks the intelligence. So with the new Da Vinci 5, we have the AI integration, and this AI integration will provide the force feedback technology, which means that it restores the sense of haptics. Simply meaning of this is that whatever the tissue the robotics arm is handling, the surgeon can feel the consistency of that tissue in their console. It means that if the tissue is like soft, the surgeon can feel the softness here. If the tissue is hard, surgeon can feel the hardness in their controls, which means that it reduces the accidental tissue trauma by the 43%. And the Indian version of this robotic surgery is that we have the India's first AI powered surgical robot. The capability of this SSI mantra is that it has the holographic planning. You can upload the CT scan of the patient and you can visualize any structure, any organs in 3D. Before the surgery, you can plan your entry and exit, how you will do the surgery by the holographic planning. It also offers the telesurgery, which means that if it can operate between the distance of more than 3000 kilometer 300 kilometer between the surgeon and the robots. So these are the specialty that is currently using the AI. So this will be in descending order. Of course, AI is good at the pattern prediction. So the first branch which is extensively using the AI is the radiology. Then we have the cardiology, pathology, gastroenterology, neurology, ophthalmology, radiation oncology, anesthesiology, emergency medicine, internal medicine, dermatology, and lastly we have the pharmacology. So this is the descending order. So I hope you like this video. If you have any doubt, you can ask me in the comment. Thank you so much for watching this video.